Hey Stephen, how are you?
Good, how are you doing?
Good, thanks.
So what are we talking about this month?
All right, so this month's CME, we're going to talk about a couple of important topics. We're going to talk about altered mental status patients. We're going to talk about toxidromes and overdoses, and we're going to talk about stroke. We're going to have a couple of guest speakers as well, talking about safe sedation and about what's going on in the evolution of stroke care. But in general, I wanted to focus this month on some of the more difficult and not immediately clear patients that we see, some of the ones that take a little bit of investigation to figure out what you're looking at, and some of the ones that can be a little bit more challenging to navigate, whether they're violent patients, overdose patients, scene safety issues, all these things. So that's really what we're going to focus on this month.
Okay. What about these topics? Why are they important to cover?
Well, as I said, I think they're things that we see often. Certainly, overdoses we see a lot.
Oh yeah.
Withdrawal we see a lot. Strokes we see a lot. But just, this is year 4 of our 4-year CME cycle. And what we're supposed to be doing this year is trying to focus on what all this stuff means at the patient side, and instead of just listing off a bunch of things that you should have remembered from EMT or paramedic school, what are some tips or tricks, and how can we actually get where we need to be at the patient side?
So you said that we're in our 4 years, the 4th year of our cycle, right?
We are, yeah. So when we initially brought CME back in-house to the county, we came up with a 4-year cycle, and it basically was year 1 is sort of back to basics, reviewing everything. Year 2 was sort of bread and butter, everything, high-risk chief complaints, things we do all day long.
Mm-hmm.
So your chest pains, your belly pains, your shortness of breath, that kind of stuff. And then year 3 was supposed to be like advanced topics. So we talked a lot about violent patients, psychiatric patients, special needs kids, that kind of stuff in year 3. And then year 4 is supposed to be kind of putting it all together. So at your patient side, how does this stuff that you learn about in school or that we review in CME, how does it really apply at the patient side?
Right. So we've had that 4-year cycle. I know it's going to be very productive and a lot of new learning for those who haven't been in the county for the last 4 years. What about the people that have been in the county for over 4 years?
Yeah.
What can they get from this CME?
There's an old joke that that medicine changes, the body of knowledge in medicine changes by like 50% every couple of years.
Yeah.
Certainly true. Listen, I'm getting ready to refresh my board certifications coming up, and so it's important for everybody to periodically refresh, including going back to basics and including checking in to see what's changed in the things that we've been doing. So having a 4-year cycle is what we actually came up with to be a good balance between not being overly repetitive every year, but also trying to get things covered in a reasonable frequency for refreshing.
All right. So any questions in the county that's been brought up? Things that you want to kind of talk about to the masses?
I think a lot of them are going to be covered in the topics of CME. I would say, though, that I do hear one of the monitors getting here. I don't know. I wish I knew. I don't know.
$1 million question.
Yeah, maybe a couple million. So I don't know. I wish I did. We'll keep you guys posted with whatever we hear. Other questions I've heard in regards to stroke destinations, things like that. At this point, every hospital has to be externally certified to be a primary or comprehensive stroke center. It's really up to them what type of stroke center they want to be. Our stroke triage does seem to be working pretty well. The other
You're talking about the FAST ED, right?
Yeah, so
right.
the comprehensive versus primary
Right.
stroke center.
We're seeing some positive outcomes for that.
Oh yeah, I think looking with our group from the Florida Stroke Registry and our nurse manager STEMI stroke meeting, I think we're seeing a significant increase in the number of people who
Excellent.
are getting really good definitive stroke care, intravascular therapy, those types of things. We're actually going to have a guest speaker talk to us, a neurointerventional radiologist or a neurointerventionalist, talk to us during this CME about where stroke care is headed, and what we should expect in the future, and how what we do in the pre-hospital setting actually facilitates that good care in the hospital.
Yeah, I've heard from some people who've been doing this for years, back in the 90s, early 2000s. We didn't even call stroke alerts. So
That's so true. Back when I was on the truck, a stroke wasn't an emergency.
yeah,
Because there was nothing to do. There was nothing to do. We didn't have
come leaps and bounds for sure.
I talked about this a little bit with the substance use disorder stuff in the December CME, but stroke has really had an evolution from not an emergency because I got nothing to do to in the late 90s, stroke became an emergency because we have an actual treatment. And now we're really seeing, I think, stroke sort of paralleling the evolution that we saw for STEMI care. So way back in the day, we used to treat STEMIs with thrombolytics, right? Streptokinase, that kind of stuff. And then we evolved to the big hospitals had cath labs, and now we've evolved to most hospitals have cath labs.
Right.
So you can see a similar progression going in the stroke care world as well. I don't know if it'll get all the way the same it is with PCI for cardiac, but I certainly think the progression is paralleling that.
So you had mentioned, we've obviously seen a lot of evolution, a lot of changes with medicine. What do you see coming to Pinellas County for the future?
Well, the new protocol book went live just a little while ago, so we have a few new things in there, which hopefully everybody's aware of at this point. I am hopeful that at some point before too long, hopefully along with the new monitors, we'll have video laryngoscopy. And with that would be a good time to talk about RSI and airway strategies overall.
That's awesome.
So there's a lot of stuff on the way, and I think we're headed in a good direction.
As long as we're moving forward, right?
Yeah, always. Can't sit back. There's always something new, and there's always something to be improved. Medicine changes fast, and we've got to try to keep up.
One last question for you.
Sure.
Who's going to the Super Bowl?
Oh man. I
Bucs?
wish I could say really confidently the Bucs.
If you're a betting man, you put some money on them.
I think by the time a lot of people watch the CME, they'll already know. So I'm not sure I want to make that prediction.
All right. Well, thanks for coming. I appreciate it.
All right. Thanks,
We'll see you.
Steven.
We'll see you soon.
All right.
See you guys.
Take care, everybody.